Alright, so I'm going to go ahead and I'm going to do my injectables portion of my medication administration now. I'm going to go ahead and wash my hands and glove up one more time, and then we will go ahead and get started. I do have my Sharps container on my patient's bed. I would never do that in real life, but just for the convenience of the video, I'm going to put it right there today. Clean pair of gloves. So I already did my first check when I went ahead and I made sure I had all these in my first video. I had all the correct items. I'm just going to go ahead one more time and make sure. I do have ampicillin. It is still current on the expiration date. My stuff that I can reconstitute it with also still current. I have both my regular and NPH insulin. They have both expiration dates are still good. I have some for my TB test. It is still current, and my morphine sulfate, they are both current as well. Alright, so I'm going to go ahead, I'm going to start with my TB tuberculosis test. I'm going to use my little pad here. I'm going to go ahead and I'm just going to clean this off real fast, clean the skin off of my patient. Alright, I'm going to throw that away. Alright, so I'm going to go ahead and I have a needle here. I'm going to be using a 27 gauge by 1.5 inch length needle. We're going to use this because this is appropriate for the liquid is not super viscous, so we don't need to have a different gauge needle, and we're not going very deep. We're just going right intradermally. I'm going to go ahead and pull that off. I have my TB here, and I see I need 0.1 milliliters of it. So I'm going to go ahead and draw back the 0.1. And real fast, I'm going to take a new one of these and just wipe off the top of this. Alright, I'm going to go ahead and put it in, inject my air, invert it, pull out the 1.1 milliliters, make sure I have no bubbles. My patient has been nice and clean. I'm not going to touch the clean area. I'm going to go ahead and inject this. Alright, go ahead and pull out. I'm going to recap my needle. Alright, and then I'm going to toss this into the Sharps, and I'm going to set this aside. Alright. So next I'm going to go ahead and I'm going to do my morphine. Before I administer any morphine, I want to double check my patient's heart rate, the respiration rate, to make sure that they don't have too low respiration rate, because it is partially a sedative and you don't want them to go under. So there's two ways you can do it. You can either use a little Carpi Jet, or you can use an ampule. So I'm first going to demonstrate how to use the Carpi Jet. So you go ahead and snap it on in. Go ahead and lock it up this way, and then go ahead and twist it in until it's nice and secure. Now this is very deceiving. You'd think there's a needle there. You would have to take this off and go ahead and attach a needle before you did it. Attach the needle, and then you could give your injection after you made sure your calculations and everything was okay. So I can see here that both on my ampule and on my Carpi Jet, my morphine is a 20 milligrams for every 2 milliliters. So I'm going to go ahead and do a little calculation here. Alright, so what I'm going to need is I need 15 milligrams. What I have is 20 milligrams for every 2 milliliters. So with my calculations, that gives me 1.5 milliliters of solution. I'll go ahead and show right down here. Alright, so now I'm going to go ahead and I'm going to use my little ampule to go ahead and do this one. So one of the things you want to do, so for this one you're going to want to go ahead and take this and you're going to wrap it around, and you're going to break it away from you so that just in case, so you don't get any sharps headed towards your direction. Maybe. Alright, and then this will go right into the sharps bucket. Alright, so I'm going to go ahead and set that right there. Alright, so I need to draw, so what I need is 1.35 milliliters of it, 1.5 milliliters of this, sorry. So I'm going to go ahead and I'm going to use a 3 milliliter syringe. And I'm going to go ahead and use a filter needle to start with, just because you don't want to make, you want to make sure you don't get any glass into your patient. This filter needle will allow it so you don't. So I'm going to go ahead, not touch the rim, and be careful. And I'm going to overdraw because it's better to overdraw than underdraw because you can't go back. And then I can always waste some and make sure another nurse verifies and they can see that. Alright, be careful to draw it up. Go ahead and recap it using a scoop. Just pop that back on, and then this would also go into the sharps. Alright, so I'm going to go ahead and I'm going to have to waste some of this. Just because I did overdraw, better safe than sorry. So I verified with my nurse. Okay, so I'm at 2 milliliters right now. I'm going to waste up to 1.5. I'm just going to go ahead and uncap for just a second. And then actually, I'm going to grab a cup real fast and just squirt it into a cup just so I don't make a mess while we're in here. Alright. So I had my nurse verify, another nurse, she can see what I'm going to waste. I'm going to go ahead and waste. Also, because it's a narcotic, you want to make sure. Waste up to the 1.5. Alright, are we good?
Yep.
Alright, perfect.
Wasted half
And
milliliter.
one more bubble down there. There we go. Okay. I'm going to go ahead and scoop and recap one more time. I'm going to set that aside. Alright, so I'm going to go ahead and just prep my patient real fast for this. I'm going to go ahead and do an alcohol pad and get it all cleaned up. Clean up a nice big area. Now this is an intramuscular injection, so as an intramuscular injection, there's like 3 main parts where you can do your injections. You can do it in your deltoid, which is about 2 to 3 fingers below the acromion. You can do it on your vastus lateralis, which is the hand's breadth below the knee, above the knee, and hand's breadth below, right around where your hip is. So then the best one is the ventral gluteal muscle. So what you want to do is you're going to put your thumb towards their groin, depending on which side you are, so it might be this one or this hand. Put your thumb towards the groin, this finger on the anterior superior iliac spine, and then this finger on the iliac crest. What this is going to do is going to give you a nice little V and a nice little general area for where you can do your injections. If you have smaller hands or bigger hands, you might need to make a little adjustments, but it'll give you a good direction to start with. So I'm going to go ahead and I'm going to switch to a different needle, because you can't give an injection using your filter needle. What I'm going to be using is a 21 gauge by 1 inch. The 1 inch is because it is a intramuscular injection, it's a little deeper, so you're going to need a longer needle. And then the 21 gauge is because it's a more viscous fluid. Often intramuscular injections are, so that's a good kind of average and good spot to go. Alright, so I go ahead and take this out. Alright, and then this will go into my sharps. I'm going to go ahead and attach this one. Alright, and then go ahead and just remove this. Alright, so I'm going to go ahead and I'm going to use the Z-Track method, so I'm going to go ahead and displace the skin. I clean the large area so it won't be impeding into my clean area, and then go ahead and give it a 90-degree angle, which is standard for an intramuscular injection. So go ahead and displace the skin, 90 degrees, pinch, and then slowly inject. Alright, once you get it injected, you're going to want to hold it for just a few seconds, just to make sure you don't, when you make sure it's all in there, as soon as you pull your needle up, you don't get a bunch that comes back with it. Alright, and then up at the same time, and you're good to go. Go ahead and recut my needle. Take that off. This would go into the sharps container, and depending on this might go into the sharps container, or you might just throw it away depending on the policy. So I'm going to go ahead and set this over here. Alright, so now I'm going to go ahead and I'm going to do my ampicillin, so I'm going to have to reconstitute. I did do one more check and make sure that they say the correct things, that they have the right expiration dates, and that I'll be safe to give them. So for this, I'm going to have to reconstitute it. So what I'm going to go ahead and do is I can see I have 200 milligrams per milliliter, and it wants me to add 10 milliliters of solution. So here's my solution. I'm going to go ahead and pop the top off of this. So I'm going to go ahead and get a new one of these, and I'm going to clean off the tops of these real fast, and then go ahead and use a different part for this one, and this will go in the trash as well. Alright, so I'm going to go ahead and I'm going to use my 10 milliliter syringe, because this is, I need to withdraw 10 milliliters of fluid. Okay, so I'm going to go ahead and attach that. So I'm going to start by injecting 10 milliliters of air into it first. Alright, I'm just going to move that one up there just a touch. Alright, not into the fluid, but go ahead and inject my 10. It should get more difficult as I get towards the end, and it is. Alright, at which point I can invert. And then go ahead and start pulling back my fluid. Let it catch up just a little bit. I'm pulling back nice and slow, just because you don't want to get too far ahead and have too much air in the vial that you can't just, not more than just a bubble's worth. Always make sure you're below the liquid line when pulling this back. Because you injected the air, part of it is just going to fill up naturally on its own. You might have to pull it back just a little bit once you get towards the 10 milliliters, because it is a large amount of fluid from the vial, even though you did displace it with the air. I'm going to overpull just a little bit, because I do have some air stuck at the top, and I want to make sure that I can get, I have enough fluid, and I will show my nurse that I waste what I waste, just because I'd rather be safe than sorry. Okay. I'm going to go ahead and do that. I have just a bubble stuck here at the bottom. get that done. So it's down here at the 10 because I have an air bubble up here at the 1. It's actually, you just hear, it's here past the 10, so I'm just going to go ahead and squeeze up to the 1, making sure I have 10 just so I can get rid of that extra air. That sometimes it happens. Alright, perfect. So we are good. Alright, so at this point I'm going to go ahead and I'm going to inject it into here so we can do our reconstitute our powder. Takes a little bit of force to get it in there. Fluid out with it. Okay, and then at this point I'm going to go ahead and I would take off my filter needle. No, you leave it on. Change my mind. Alright, so I'm going to go ahead and just roll this up so I can get it nice and all mixed in. Nice and reconstituted. You don't want to shake it, you want to roll between your hands because if you shake it, it just gets it too mixed up and it just doesn't work correctly. Rolling between your hands is a good way to get it nice and mixed up appropriately. Alright, so there's 1 or 2 little spots in there still. I'm going to go ahead and let them dissolve and do my calculation. So at 10 milliliters added fluid, it's 20 milligrams for every 1 milliliter. 200 milligrams, sorry. So I'm going to go ahead and do a little calculation. So what I need is 375 milligrams of ampicillin. What I have is 200 for every 1 milliliter. I do that, I get out my 1.9 milliliters of solution. Go ahead and show my work here. Okay. Alright, so at this point, I'm just going to go ahead, I'm going to open one of these and just clean it off one more time, just in case my glove had touched it and I hadn't noticed. So I'm going to go ahead and do this. I'm going to pull up the 1.9. Actually, I'm going to go ahead and take this off. And I'm going to throw this away or in the sharps, depending on where they would like it. And I'm going to use a 3 milliliter syringe here. 3 milliliters is more appropriate for 1.9 just because it's closer and you can be a little more accurate. So I'm going to go ahead, put that in there. I'll go ahead and invert and pull out the 1.9. My needle's having just a little bit of trouble pulling it up, so I'm going to have to go pull a little bit more than the 1.9, and then I'll just waste just a little bit. I'd rather be overcautious than not and have to waste, but still have plenty. Alright, so I'm going to go ahead and do that. So right now I have no air bubbles, but I'm going to go ahead and just waste a little bit just because I had some air at the top. So I can refill it up. Right now it's at the 2 and I want to go up to the 1.9. Perfect, there we are. Okay, I'm going to go ahead and recap at this point. And I'm going to get out a different needle. This is also an intramuscular injection, so I'm going to use the same gauge and the same length as I did for the morphine. For the same reasons, a little more viscous, and intramuscular injections, you want to be low. You want to go a little lower. This will go into the sharps. And then for the same, when you're doing an intramuscular injection, you don't want to do two in the same place. So if you do one on one side, maybe switch to the other side or go to a different spot. Okay, so I see that. I'm actually going to recap it real fast so I can clean my patient and get them prepped appropriately. So go ahead and get a new one of these. Clean the area off, then throw that away. Okay. All right, I'm going to use the Z-Track method once again. So I'm going to just place the skin, go in, and then go ahead and inject. The Z-Track method helps because it displaces the skin in the top layer, and then once you go ahead and you lift up, it covers it back over and allows the skin to be able to absorb more, the patient to absorb more of the medication. And then up at the right time. Perfect. I'm gonna scoop and recap. And then sharps and depending on what. Alright, so right now what we have left is we're gonna go ahead and do our insulin injection for our patient. Before you do insulin, you wanna make sure and test their blood glucose levels and make sure they had food on somewhere on the floor or coming, because you don't want their levels to drop. Plus, you only have a few minutes to give it after you draw it up. Alright, so I'm going to be giving 16 units of the NPH and 9 units of the regular. So I'm going to go ahead and just verify one more time. These are the correct ones, they have the right expiration dates, and we're good to go. So I'm going to start. I'm going to go ahead and clean these off. Okay, let me get one more. Alright, I'll clean this off and then go ahead and use a different side or different area for the other one. So because I'm going to need to do 16 in the NPH, I'm going to go ahead and inject 16 units of air into the NPH vial without touching the fluid, which is important. Okay, and just pull up. And then I'm going to do 9 into the regular vial. When you're dealing with an insulin needle, it's a very small gauge. It could be something like even like a 28, 29, depending on your patient. And it's also very short, very similar to the TB test, just because you are, once again, you aren't going very deep, even though this is a subcutaneous. For which areas you could give under the arm, on the belly, but around the belly, but make sure you're at least 2 inches from the belly button. You can also give on the scapula, on the leg, just kind of depending on what your patient prefers. And I just realized that I did those in the wrong ones, so I'm going to go ahead and dispose of this and get me some new vials of this real fast. Thank you. I'm just going to grab a new needle real fast. It's a 2D needle. That won't work. Very important to make sure you're injecting the right amounts into the right ones. I didn't, so that's why I just went ahead and started over. Okay, clean those off once again. All right, we're going to do, this is the regular one, this is the NPH, so we're going to do 16 into that one. Okay, 16 into the NPH. Nine into the regular. The regular one I'm then going to invert and pull out the 9 units. Alright, didn't get any bubbles, so we're good there. I'm gonna set that there. And then for the NPH, I'm going to go ahead and recap this for just a second. And this one, I'm going to go ahead and just roll, because you can see the NPH has some stuff, so you need to mix it up and make sure it's properly mixed in. Alright, and I think we're good. Okay, so I'm going to go ahead now. I'm going to pull back to the 25 because the 6 from there, the 9 from there, plus the 16 here will be 25. You want to be really careful not to inject any into the NPH because then it'll ruin the insulin in there. Just pull back until you get to what you need. Alright, I'm at 25 appropriately.
And as our nurse, I saw that she drew up 9 and then that she drew up 16 for a total of 25.
So I'm going to go ahead and set that aside. I'm going to recap this, get my patient here. Go ahead and prep them real fast. And like I stated, you could do it in the arm, the belly, as long as you're not too close to the belly button. Scapula, there's lots of areas you can give your insulin injections. Do that. Alright, for insulin, because it's a subcutaneous, you can either go at 90 or at 45 degrees, kind of depends on your patient. Our patient is a little thinner, so I'm going to go at 45, but for other patients, you may be able to do the 90. Go ahead and uncap that. Alright, just going to go ahead, and I'm going to go ahead and go at a 45-degree angle. Okay, and then I'm going to inject. Hold it in there for just a second, and go ahead and release. I'm going to recut my needle, and then this will go into the sharps. Also, anything that can be reused, such as our insulin, I'm going to go ahead and just initial it and put the date that it was used. So I'm going to go ahead and initial all my bottles. Make sure I put the date. This one is reconstituted, so I'm going to show that it was at the 200 milligrams per milliliter. That's what it was reconstituted to, and then I'm going to initial and date it. Same as with these ones. I want to make sure everyone knows when they were used, so nothing, so no one gets confused or nothing weird happens. Anything that we are done with or we can dispose, I'd throw away into the sharp, such as an empty bottle, I would throw away into the sharp container. Alright, so that's all the medications that we had to administer today. Another important thing is, I don't think I mentioned earlier, before you administer anything, make sure you double check your patient's allergies and make sure they're not going to be allergic to anything that you give to them.